When people start learning about the neck, they successfully form the N, the E, then the C, and then it all gets messed up. So today, I am here to clear up all this mess up and form a correct N, E, C, K in muscles. The neck has two parts, the anterior part and the posterior part. Let us first learn about the anterior part. The anterior part, I am going to tell you about the main bones, the muscles, some important veins, glands, and what the anterior bone protects and supports. So first, the main bone in the anterior part is the hyoid bone, which supports the mandible or the lower jaw bone. The hyoid bone has two muscles coming out of it, named infrahyoid muscles. These infrahyoid muscles look like straps, so they are known as strap muscles. And what does the infrahyoid muscle protect? It protects the epiglottis, the thyroid cartilage, and also the trachea, and also the thyroid gland. And now let us talk about the triangles formed by the muscles in the anterior part of the neck. The triangles formed in the anterior part of the neck are known as the anterior triangles. So there are two muscles, important muscles named sternocleidomastoid muscles, and they attach to the sternum and also attach to the hyoid bone to form a triangle. These two are posterior triangles, which I will be covering later. So this triangle formed is known as the anterior triangle. Now this is not the exact replication. There are actually two more muscles that cover the whole diagram like this, and they are known as the platysma muscles. Over here there are two platysma muscles, right and left. And now let us go to the veins in the anterior part of the neck. There is the jugular vein running over here, and the collar bone is known as the clavicle, and the breastbone is known as the sternum. They also help in making a proper triangle. Now let us move on to the posterior part of the neck. You can see many capitis muscles. What is capitis? Most of the capitis muscles are there just to support the head, like the semispinalis capitis, the splenius capitis, the longissimus capitis, the iliocostalis capitis are all some of the capitis that support the head. And there are also some bones like the scapula, and they are protected by the levator scapula muscles. Now there is one of the most important parts in the human body is, of course, the spinal cord. The spinal cord runs through the neck, and the top and the bottom, the starting two bones of the spinal cord are axis and atlas. And now and there are also triangles formed on the right and the left of the posterior part of the neck. So the same sternocleidomastoid muscle and the huge trapezius muscle attached together on the top, and the middle of the clavicle bone together form a triangle over here. Now this together makes the posterior part of these muscles make the posterior part of the neck. And there is also one important vein that runs through the posterior part. Its name is temporalis vein over here. Now let's summarize. So what does the anterior view of the neck do? It protects the epiglottis and pharynx, thyroid gland, etc. The the anterior of the neck, there is the hyoid bone, infrahyoid muscles, and the triangles over here, here, and here, and also the sternocleidomastoid muscle, the clavicle, and the sternum or the breastbone, and there is the mandible. Now the posterior side has the capitis muscles, the sternocleidomastoid, the trapezius muscle, the scapula, and the temporalis vein, and also the splenius capitis muscle, and the triangle formed is over here. Thank you.